I think for the Lakeridge PET-CT, it's one of 18 across all of
That
Ontario.
is diabolical.
So there are
That's
only
so low.
18 scanners across all of Ontario. So when we talk about Lakeridge as a community hospital, yes, it is a community hospital, but because the population in Durham is growing, because the cancer center is here,
Well, that's
because
not why it's growing, but yeah, the two,
no,
correlation is not
yes,
causation.
yes, because of a lot of things that have pushed Lakeridge as an organization, as 5 satellite hospitals to grow, has pushed it to grow. It's scary, and it was only a matter of time before we were going to get a PET-CT to serve the community here, but also to serve anybody else in Ontario that needs a PET-CT, because that wait list is very, very long.
Today we're in the PET-CT suite, which is something brand new for Lakeridge. I'm actually standing in one of the hot rooms right now. It's not just hot because I'm in here, but it is a lot hotter because I'm in here. Before now, 30 people a week were leaving the community, heading downtown to get scans, dealing with unfamiliar territory, a brand new healthcare team. I mean, I was one of them. I've had over half a dozen PET-CT scans, and to know that we've got one in my community means that I, like many other people, are getting better, more efficient healthcare. This is something brand new that was made possible by millions of dollars of community funding, including 2 massive gifts from Beth Kelly and the Mackey family. Today we're speaking with 2 absolute beauties, Dr. Michael Kwan, who's been at Lakeridge Health for over 35 years and was instrumental in getting the PET-CT scanner here in the first place, and we're chatting with Wilson Yiu. Thanks to these 2 and the rest of the team at Lakeridge Health, people are getting the best possible care they can close to home. So let's brace for impact with Dr. Michael Kwan and Wilson Yiu. This machine is very cool. I think you guys are a little bit cooler because you know how to use it, right? Like, yes. I come up, I'm like, oh, buttons, I'll press the buttons. There's a nuclear button, there's a stop button, they look fun to press.
I'm the medical director for the nuclear medicine division.
Damn, that sounds pretty cool.
Of the Diagnostic Imaging department at the hospital.
That's got to feel pretty cool when you're introducing yourself at a party, especially with someone like me. I'm like, I have a degree in television, and you're like, here's what I do.
Well, I've been doing medicine for over 30 years. I've been at Lakeridge since 1989.
Damn, okay.
And nuclear medicine is my specialty.
Yeah.
PET scan is just one evolution of nuclear medicine. So we've been advocating for this for many years. Our hospital has. And finally, over the last few years, we are able to make a reality to serve the patient in this community with this nice technology.
I started off as a technologist, so I was a nuclear medicine technologist. That's what I went to school for. You're interacting with patients. You are getting pictures, basically, of patients in our machines, depending on whatever modality it is that you're using. So nuclear medicine specifically, we inject radioactive isotopes into patients, put them under our cameras, and take pictures of where that radiation has gone in their body. So I started as one of those nuclear medicine technologists, moved on to also take on like a post-grad MRI course, and then eventually worked my way up through UHN and heard that, Lakeridge was getting a PET-CT. They coincidentally had a manager position open. And I was like, well, I think it's serendipity. So I look after nuclear medicine, MRI, PACS, PET-CT, and BMD. So
you're throwing a lot of letters at me. What's a PAC?
What's a PACS? PACS is what we archive our images on and our studies on. So
like a memory card
we don't save things on paper. Obviously, we don't save things on memory cards because those get lost and stolen. Everything is saved in an archive, so a picture archiving system.
Okay, so, like you see in old movies, like the little microfilm, and they go to the library and they're trying to crack the cold case.
Yeah, sure. Exactly like that, except in the form of multiple servers and where we're saving all of the data that we're acquiring here.
How many terabytes or petabytes of data do you have?
Oh my God. Okay. Well, now we're trying to move away from physical servers and go into the cloud.
Yeah.
So that's another big project that I'm working on. Moving to the cloud.
Just put them in here. This thing looks like it's got some extra space.
But yeah, so there's a lot of different parts to my portfolio as well, other than PET-CT.
So we've got 2 kind of timelines, right, Dr. Kwan? It's been it's been over 35 years. I can't do math. You guys are the ones who need to do math. I have an arts degree, not me. What has it been like working together? What has it been like unleashing this thing, right? This is a brand new piece of technology for the hospital. This has been around for a while. What has the reception been like?
Well, it's really a team effort. So it has a lot of work has been done in the background. So the technology has been available clinically. So we have to inform our administration that we are ready to do this, and then they put a team together, and we work with each other and tell the government that this is needed here in this community, and work up a budget. And we have to put the technologist team, the physician team. We have to make sure the referring physician knows about it, and obviously the patient, because that's most important. That's really the center of this project, to serve the patient. So it's been a long road, and but it's I think it's very good for the community and to the country as a whole.
Well, and the people that you've both been talking to, Wilson, maybe you can help me out with this one. Like I've had over a half dozen PET CT scans at this point. Not that I'm bragging or anything. I'm good with. I think I've had 7. I'm good with 7. I don't think we need number 8.
You're good at lying there and not moving.
Yeah. I'm curious though, like when you're talking to patients, because I've done the schlep into the city, right? The very first episode of this podcast, we were speaking with Mark Gibbons. Him and I were both Hodgkin's survivors. We intimately know, as many people do, the drive into the city. It's like 90 minutes to get in there. Traffic, it's a whole thing.
Yeah, so I think a lot of our patient population is very, very excited. I used to also go downtown for work. So when I worked at Princess Margaret and Toronto General, I didn't even like going downtown for work, much less going downtown for a cancer scan. So I can only imagine how somebody, if they lived in Durham region, had to take the bus or take the GO train or whatever it is, try to find parking, especially today. It's snowing a lot. So imagine trying to get downtown in the snow, stuck in a car, thinking about like what's going to happen when I get the results of my PET scan, what's going to be my next course of treatment. I think it's much, much nicer to be able to go to your local community hospital, to see the people that you've seen throughout the rest of your cancer journey and have everything done here. The cancer center is here, your clinic is here, your physician's here, have your scans done here. That continuity of care that we really want to look for our patients is so that you still see that same friendly face every time you come to the hospital, as opposed to a new person here, a new person there, and the hour-and-a-half drive each way, right? So I think people are really, really appreciating having everything done at the same place, having all their doctors at the same place, and not leaving their comfort zones to go somewhere else.
A lot of new faces. That's a good point. I can remember, like, my primary care was here at Lakeridge, and then I'm going into Princess Margaret, or I'm going in to get a scan somewhere else. And you're like, a million other faces and names that I'm going to forget immediately. And you're already very discombobulated. And with the drive, it's a different kind of drive. Like 90 minutes to go into the city to see your favorite concert. If you're, Taylor Swift was here late 2024. Maybe you're going to see Coldplay. Like maybe it's like date night. You're going to a fancy restaurant in the city. The anxiety that comes, and I can never pronounce this properly, scanxiety. I have it. I don't know how to say it. But like that 90 minutes feels like a year and a half. But knowing that it's like a 10-minute drive.
I think it's hard on patients' families as well. So if somebody had to go downtown for treatment or any sort of scanning or whatever it is, usually somebody may go with them, like a family member would go with them as either emotional support or even physical support, depending on if you're going through a course of chemo or whatever, you're really weak. And that's logistically hard on the families as well, because they have to take time off work. They have to figure out how to get there. I think one of our patients that recently did an interview with the foundation was saying that him and his wife live very, very close. So normally either his wife would have to take time off work and then drive him down or whatever it is, because they only have one car.
And that gets expensive,
yeah,
right?
Exactly.
Like, not everybody has paid vacation days. Not everybody
has. Because he lives so close. Yeah, he could take Uber straight to the hospital and get his scan done and not have to have his wife take a day off work so that they could both drive down together or whatever it is. So.
And the food court here is pretty good. Yeah. You got pizza, you got sandwich, you got everything, right?
Yeah, like you said, it's more than just time. It's a stress that you mentioned. It's a thought of going, for somebody who had never had the procedure done, you don't know what to expect.
Yeah.
You don't want to be late. The traffic in Toronto, as we all know, is not
and
great.
Listen, there's only a couple of slots, right?
Yeah.
These things are rare.
Yeah.
If you miss your appointment,
so,
it could be a week.
You get behind a traffic light and traffic, you get really nervous. You say, I'm going to be late. I don't know what should I be prepared for? So on. It's very stressful to go somewhere far for your procedure. So it's not uncommon, actually, even for people going for therapy. I have patients that have gone downtown for a consultation to get an opinion, and they need a certain type of treatment. It's not uncommon for them to come back to Oshawa to get the treatment if it's available here, because it's much better for them all around, time-wise, stress-wise, and so on.
Well, and even like, this thing is intimidating, right? Like it looks like the HAL 9000 from 2001: A Space Odyssey. Like this is, it's an expensive piece of machinery. It's very foreboding. Like let's take it back to 2020. I know it's a scary year for everybody, but we'll take it back to 2020. I'm getting diagnosed. I have a 6-month-old daughter. The pandemic's raging, right? Like I'm very nervous about this whole thing. Would my doctor, if we had this here at the time, would my doctor have been able to say, why don't we go take a quick peek?
Thankfully, our PET CT is much, much bigger than a standard MRI. It's about, I think, 76 centimeters wide for the bore.
I've never had an MRI. I've had a million of these things.
Yeah.
But how much smaller is an MRI, just out of curiosity?
So a typical MRI is about a 60-centimeter bore.
And what's this?
76. The MRIs are a lot longer. So they're more like a tube. This one's much more condensed, so that even when you're in there, you can still look back and see that, it's not completely enclosed. There is a backside that you can look out of. No, you can't really see it, but we also have little screens on our ceiling.
With Netflix?
No.
Because you go to the dentist sometimes, they got that TV. You should get like a tablet or something.
At Sick Kids, they have that. So, Sick Kids, they have that. You can play videos and stuff for them at Sick Kids.
New season of Bridgerton or whatever, yeah.
But we have like these little ceiling tiles up in the ceiling here that we customize so that patients can see like a nice spring view of cherry blossoms as they're going in for their PET CT. So hopefully that also helps their anxiety. Hospitals themselves are usually very, very scary because very, very sterile. It's not a natural place that you would go to.
You want them to be sterile, right? You want them to be kind of clean.
Yes.
Can you help us understand why imaging is so important? And like, I've been through it and I kind of get it, but for someone who maybe is like facing this, maybe somebody who has a family member and they're trying to like make them feel more comfortable about this. And they're going like, why the hell do I need a PET CT scan? Why do I need any kind of scan? Like, what are they looking for? Can't they just like poke me or take a blood sample? Like, what's the difference with imaging?
So with imaging, does play a very important part in the medical care. So it allows us to see within the body. So with our naked eye, sometimes we're limited what we could see or feel. But with imaging, now we could see within the body. How is that helpful? Well, first of all, it's able to detect things that are small before the patient feel any symptoms, before they feel pain or short of breath or whatever. We're able to see the abnormality much earlier. So if we're able to see it earlier, we could treat it earlier and better. Also, if you do have known abnormality, we're able to now see the extent of the abnormality much better. So we could tailor the treatment accordingly. So, does this patient need surgery, or does it need medication? Does it need radiation, or should we just watch it? So all this stuff, all this more information that we get, it helps us to make a proper decision how the patient should be managed.
And what about this kind of imaging? Because this is a combination of a PET scan and a CT scan. What would be the difference between that and like just a PET scan or just a CT scan?
Well, PET scan offers us an additional dimension about the patient. So most of the imaging, for example, X-ray, CT scan, or MRI scan, give us very good information about how it looks. What does it look like? Where is it? It has some limitation, but it's very good. But with PET scan, we now have an additional dimension. We are now able to look at the biology, the function of the abnormality, if there's any abnormality. And so with the two combination, because they each complement each other. So for example, we have a PET CT scan here. So with the CT scan, we're able to see where things are. And with the PET scan, sometimes we cannot tell where exactly it is, but with the combination of the two, we're now able to pinpoint where the abnormality is and what is its biology. So it actually helps each other. We improve the CT scan detection, and also now we could have additional more information about the abnormality of question.
So the sum is better than the parts, essentially.
Exactly.
Yeah.
So even now, people are researching on PET MRI scan, combining MRI scan with PET scan, because again, they complement each other. So it's not like one is better than the other because they offer different information.
The injections that you're getting for each of these things, and then how this, you called it a glorified camera earlier, how that's picking up the sugar and the way our bodies metabolize it.
It all depends what we give the patient to determine what we see. So one of the most common procedure is what we call a glucose type of procedure.
That's the sugar that I'm getting.
The sugar,
okay.
Yes. So we give a radioactive glucose, basically, which is emits a certain type of radiation called positron, and that's the positron that's detected by the camera. So now we have a tracer. So wherever that glucose go, we could see it. So all our tissue metabolize glucose, sugar. So everybody needs sugar. All the tissues need sugar. But we know certain type of tissue require more sugar if they're abnormal. For example, cancer, which is one of the common indications. There are others, but one of the most common ones is cancer. We know certain type of cancer metabolize sugar much more than the other tissues. So we're now able to see it. So if we see area with a high sugar metabolism or function,
You're like, that might be cancer.
exactly.
But it
yeah.
couldn't, because I've had
something
false
else.
positives. It could be something else. Okay.
Exactly. So it's not specifically for cancer, but it could be other things. But
Yeah.
when we put things together, for example, how the CT looks and how patient is the background, the patient's background history, we now are able to make a much better educated determination what we're looking at.
Okay.
Yeah. So, as I said, glucose is one of the common procedure that we do, but there are others. And, over time, we're going to be doing other
Well, like
type
what
of
else?
procedure.
Like what's available now, and what do you think we're going to see in the next couple of years?
Well, for example, in cancer, we like I said, we could use glucose, but we now have tracers that are specific for certain type of cancer.
Really?
Yeah. So, for example, prostate.
Okay.
So it's a prostate-specific membrane antigen chemical.
Okay, I think I've heard of that one.
Yeah.
That's like a PSA,
we could
right?
now exactly.
PSMA, yep.
Yeah. So we could use that tracer, which is with a different type of radioisotope. We could inject that into the patient and see where it goes and determine the extent of the cancer. Well, if there's any cancer, and also determine the extent. And now knowing that, we could now go to the next step and say, hey, if you have this type of chemical uptake, we could now target your treatment accordingly.
Okay.
Because we could now give you a medicine that's directly specific for this antigen.
Yeah.
And for this where it goes. So we have a
Man.
much better target.
Yeah.
So this is one example, but there are others.
The nuclear symbol, like, it looks very scary. It looks like an episode of Fallout. Where does isotopes? Like, what are you putting in us?
Well, so for example, the glucose is labeled what we call fluoro-18, which is a positron-emitting isotope. It's a small little bit liquid. So first of all, the patient doesn't feel the injection.
Yeah.
It's a small injection, goes in under 10 seconds, and it travels around the body. We allow about an hour for it to go where it's supposed to go to.
So you get one of these, you've had like the radioactive milkshake or whatever, which a milkshake might be better, right? Like you're getting cancer treatment, you're losing some weight, the extra calories, we'll take those. Can I give my kid a hug afterwards?
So obviously there's radiation involved, and fortunately the radiation doesn't last very long.
Okay.
In a few hours, majority is already been excreted
Okay.
from your body.
Yeah.
So there is some precaution we ask patient to take for the day of the treatment.
Like sitting down
of
to
the
pee.
procedure. Yeah. So
Which is nice. It's a little rest.
And then afterward, you just carry on as usual.
Yeah.
But so there, we just have to take it with care.
Yeah.
Yeah.
Maybe we could just like tell cancer patients that, like, if they don't want anybody around them, just go like, I'm radioactive, right? Just scare off all the neighbors.
I don't know if you want to say that.
Yeah,
but
no, it's fine.
patients always ask, am I going to glow after this?
Yeah.
I'm like, yeah, you are actually under the camera.
Yeah.
But I think the amount of times that patients ask, am I going to glow? Am I going to glow? Am I going to glow? It gets tiring for us, but we understand, like, you don't know.
Yeah.
So we always answer that, yes, you are under the camera. But for all other intents and purposes, nope, no one's not going to know that you're radioactive.
Yeah.
And it's not dangerous for the general public. So,
But again, we're still going to let people, if you want to pull that, that's the cancer card, right? I use the cancer card on a couple of things. I never have to go to certain big box build-it-yourself furniture stores with my wife, and I get to shout that I'm radioactive in a crowded mall. It's nice. Yeah, people get out of your way. So I, born and raised in Oshawa, I have since moved back with my family. Like, this is my community. This is, we all live in the GTA, but like, these are my neighbors. You see these people at the grocery store. Like, we interact with each other. Is it becoming more common to see a community hospital have one of these incredible machines?
Well, when you're talking about this room, how it first came about is we nuclear medicine, I say we move up to this area in around 2007, 2010, in that time period.
Is when these were kind of invented.
Yes, exactly.
Okay.
So at that time, we were already planning for such a technology. So that's why this room was available. We purposely planned it So we could sort of easily do some construction and fit in this technology. So planning's been going on for a while. When you say community hospital, most community hospitals have this type of technology? Well, when it first started, no, most of the technology was in the teaching hospital, rightly so. But over time, since this modality is very useful for cancer care, it makes sense for a hospital that has cancer center or cancer treatment to have some type of technology, to have this type of technology available. So it's now getting more common over the last 5 years or so that the community hospital that has cancer care have this type of equipment.
Well, I think for the Lakeridge PET-CT, it's one of 18 across all of Ontario.
That is diabolical.
So there are only
That's so low.
18 scanners across all of Ontario. So when we talk about Lakeridge as a community hospital, yes, it is a community hospital, but because the population in Durham is growing, because the cancer center is here.
Well, that's not why it's growing, but yeah, the two,
No,
correlation
yes.
is not causation.
Yes, because of a lot of things that have pushed Lakeridge as an organization, as 5 satellite hospitals to grow, has pushed it to grow. It's scary. We are, I think, one of the biggest hospital systems in Canada, to be honest, and it was only a matter of time before we were going to get a PET-CT to serve the community here, but also to serve anybody else in Ontario that needs a PET-CT. Because that wait list is very, very long, right? So the wait list for a lot of imaging, diagnostics in general, is very, very long. So when I saw opportunity to join Lakeridge, I think it was a very good opportunity to grow with the organization as well. There's a lot of exciting things that are happening here. I think last year we got some robotic surgery thing in surgery.
Let's put some respect on the name. The Da Vinci robot.
The Da Vinci robot, yes. We got the Da Vinci robot last year, or the year before that. Technically, last year we got the PET-CT, and it's just very, very exciting to see where else we're going to go next.
So when you hear the announcement, both of you, and again, you've been here for different periods of time. Dr. Kwan, it's been over 35 years. Wilson, it's been a couple of years for you. What was that initial announcement like when they're like, we've raised the money for this? The government has I don't know if they're actually using a rubber stamp, but what's that day like? Is it a phone call? Is it an email blast? Is it like little whisperings in the hallway?
My point of view is probably different from Dr. Kwan's point of view, who's been here for much, much longer. But I think coming here to Lakeridge and knowing that Lakeridge was going to be one of 18 centers across Ontario that will be getting a PET-CT. So it's still quite rare for any sort of organization, any sort of hospital to get a PET-CT, to be approved for PET-CT. That was very, very exciting. And I think in terms of how that PET-CT is going to inform how Lakeridge grows, how we're able to better serve our community, our patients. We are connected to the cancer center.
Well, and when you say one of 18 machines across the province, not to poo-poo getting another dialysis machine or not to poo-poo getting another incubator, but that there are probably hundreds or thousands of those across the province. To say this is number 18, right? I think that really puts it into perspective. And I'm curious, Dr. Kwan, you've been here for a couple of decades. I'm sure this is vastly different from what you were working with in 1989, for instance. And you in particular have been a champion for this for, I think, over a decade at this point. Can you tell me about the work that you've put in to make this happen?
Well, first of all, we have to make sure that the hospital is ready for it. So we have the space. We have to make sure that people are ready for it. So people who's going to work on the patient, so they get proper training, myself including getting proper training, and the technical staff. So those, takes time. And unfortunately, the timeline was a little bit long, but we were ready. So we were ready before that. And a lot of my colleagues laugh about it, said, we're not going to see this until I retire, which actually a couple of my colleagues has retired and has not seen it.
Listen, after this is the feather in your cap. I'm giving you permission. I don't know what your finances look like. I'm not going to help with those, but you should hang it up. This is it. Take some time on the beach.
So for me, I'm quite happy because I'm, entering my latter stage of my career, but I'm still able to see it in footation and in reality. So I was quite excited.
How did you
And
celebrate?
when I first saw it, actually, I couldn't believe it. Did I read the email wrong? And I was really excited after I seen it to say, hey, this is coming. And I know it's going to be more work after that because there's just the first initial announcement. There's going to need some financial support.
Always.
And obviously people support. Make sure how people are ready for it.
Well, and speaking of people being ready for this machine in particular, patient number one, what was that like? Were you both in the not necessarily in this room, but like in the control room? Were you like here that day? Was the person aware that they were the first person to go through this machine?
I actually think the first patient that we scanned wasn't even aware that they were the first person
Wow.
to get a PET CT
Yeah.
at Lakeridge. But I
They're
think
probably already nervous enough. They're like, I don't want to make a mistake here. I'm the first one.
Well, I think they were just beginning their cancer journey, so they didn't really have that well of a grasp on what it would have meant if they had to go down to Sunnybrook or go down to PMH
They're
or
like,
whatever.
I just want to get in and out. You know, it doesn't need to be a confetti. Maybe that's nice. You got to clean it up afterwards. Balloons, okay. Maybe a cupcake afterwards.
With that being said, I think we've scanned enough patients now. I think we're well on our way to scanning almost probably 200 patients by the time this fiscal year ends, having gone live at the end of October. So I think patients have come to us saying that it's so nice to have everything done here. It's so nice to not have to, like I said, take time off or whatever it is, or they can come with their daughter or come with their husband or whatever. They can go get a Tim Hortons.
Make it a date,
done.
right? Have fun.
Yeah, you're done in about 2 or 3 hours, and you go home, take a nap, whatever, and it's much easier for them.
Yeah.
So they've actually told us that, and it's nice to hear as well. And the
Now, you
staff
said-
are very, very happy.
It's late January when we're recording this. You've said you've had this online for a couple of months now. What's capacity like? Like, how many people are you able to book? How many appointments can you book? How many tables can you turn over in a day? And what do you think your capacity will be when you're like running prime optimization?
So currently, right now, we are still in the process of training all of our staff. So everybody that works in general nuclear medicine is getting their training on PET CT as well. So just so that we have everybody able to work in general nuclear medicine and in PET CT. So we're kind of on the tail end of finishing up training for everybody here.
Yeah.
So currently, we're scanning about 6 to 7 patients per day, operating about 3 days a week.
Okay.
So looking very shortly to start operations from Monday to Friday. So if we're starting operations Monday to Friday, 7 patients a week or 7 patients a day or so, I think we're close to hitting almost 2,000 patients in a year.
Wow. Okay.
But like just speaking with some of the other cancer centers out there in Ontario, the demand is so high. That
Are you going to get a second one? I know you don't
know
want
if
to
I'll ever be
look like
approved for a
gift horse in the
second
mouth, but
but I think we will have to start looking at, if we can operate later on in the day. I know a lot of other pet centers are operating on Saturdays as well,
Yeah,
Saturdays and
round the
Sundays.
clock.
So it all depends on funding as well. So all of these conversations have to happen with the Ministry of Health, right? So they inform us kind of like, oh, these are kind of our expectations for you. For this year, we think you'll do, 2,000. So that's the funding you're going to get, 2,000 patients. And we'll try to meet those expectations with the amount of staffing that we have and the amount of demand that we have, working closely with our cancer center, working closely with our physicians and our staff, just to see what we can do, because the demand is there. There's a lot of need for diagnostic imaging across Ontario.
now in every hospital there, or in every workplace, I should say, there's the cool team, right? There's the cool part of the office. There's like, oh, I work in I work in accounting, and then no shade to accountants, but like I work in accounting and I want to work in marketing or whatever. This has got to be like the cool spot, and like everybody wants to be assigned to this room, probably, right?
Definitely.
Yeah.
We're all very hot.
And not just because you guys work here, but yeah.
Yeah.
Let's talk about actually paying for this thing, how we get the money. It's a lot of money. Like I think it's over $5 million for the machine in the first year of funding. I think I'm close to the number on that.
Yeah. So 5 million is for the combination of the machine and the renovation of the space.
Okay.
Put together.
Because like the government doesn't pay for this, but you were saying, Wilson, the government will like cut a check they'll go, we think you're going to do this many scans. We're budgeting each scan as X amount of dollars. So we'll do the math, 2,000 times X is whatever it is. What about the community effort? Because again, like these are people, these are our neighbors. These are people that we're going to the same supermarkets and the same movie theaters with. How does this kind of money get raised? Like, can we talk about the fundraising portion of it?
Yep. So that 5 million, like Dr. Kwan said, encompassed the cost of the machine and encompassed the cost of all the construction. So part of it was paid for by the ministry, I guess, in terms of their budgeting, but a significant portion of that came from our foundation as well. So there was a significant fundraising that happened with the Lakeridge Foundation through their cancer campaign. A lot of things happened there. We integrated a lot of our own team fundraising events as well. So last year we operated a dunk tank.
Were you in the dunk tank?
I was not in the dunk tank.
Were you, Dr. Kwan?
No. A lot of our
Wussies.
executives were. So we had, I think, our foundation CEO was in there, some of our VPs,
Yeah.
a lot of our physicians. There were a lot of our chief directors and stuff were all in there. So
Did they volunteer or did they get voluntold?
I think they were voluntold.
Okay.
But we at least made sure the water was warm. And
Yeah.
I think their teams were very, very excited to throw balls at them and try to dunk them into the water. So we raised a significant amount of money there. And I think a lot of people had a lot of fun doing
Like,
that as
we,
well.
we paid for the thing in a day. I don't know what that says about, people's feelings towards management, but you got to pay for it somehow.
Yeah. But it was a lot of, I think, community effort that came together to help pay for this because people are, like you said, very excited to have the PET CT, right? It's a very special machine and not a lot of places have it. So not just the hospital, but the greater community came together to bring this here.
That's got to feel really cool, right? Like the patients that you're working on, their families are cutting some checks, maybe, or neighbors, or maybe people who don't know them and people who, fingers crossed, will never have to deal with a malignancy or even the stress that comes with getting scanned for one. But that has to make you feel pretty good, the two of you, right? That like, this truly is, we talked in the pandemic over and over again, and it became quite trite. Eventually, people would say, we're all in this together. And it's like, are we though? But this is an example of everybody being in this together, right? This is money that's raised in the community for the community.
Yeah, I think everybody has a story. And, even some of the donors who may not be cancer survivors or don't know anybody that has had cancer, but everybody has a story. And when you share that story, it kind of informs people on what it is that they want to put forth in the community. Like, what do they want to help out with in the community? So we have had some donors come by to see the PET CT specifically because maybe they donated to it or they heard about it or they were part of some sort of fundraiser. And when they see it, I think it feels real to them, right? Like when you're donating to something, you're like, I'm not sure if it's going to anything, but here they could actually see it. And if they ever need it, it's right here too. So I think that is kind of eye-opening for people.
Well, and that's the reason we're doing this project, right? We've recorded an episode with the Da Vinci robot. We've been in the systemic suite in this beautiful cancer center, right? That was also partially funded by donors. And could you talk a little bit more about that feeling people have when they make something like this happen and the feeling that you have when people make something like this happen? Like, talk about the togetherness of it all.
Well, I think it's a good feeling that we're able to contribute to the well-being of the community, everybody, yourself, is because you're now part of it. You feel that you are enriching the community, the people around you. You don't know who's going to benefit from this. You could be yourself, could be others, but I think the community as a whole should be very excited that we have this type of technology available, because I really feel this does contribute to their well-being.
Yeah.
So you help them determine. You don't want to get sick, but when you do get sick, you want to make sure that you're getting the most appropriate care. Meaning, what kind of disease do I have? What's the likelihood? What will happen to me? What kind of treatment should I be getting? Because it's not easy to be when you're not well, and you want to get as much to know as much as possible. And by having technology like this and others in the hospital, that we are able to contribute to the well-being of the society, and that's, I think, is a good feeling as a donor or as a worker. Because it's nothing better than when I read this examination that I'm contributing to the well-being of this individual. So I'm offering information that will help him in his journey. And as a donor, you're doing it as a whole for the community. As for me, it's on the individual basis.
Mm-hmm.
Yeah, I think the team really felt that it was unbelievable that actually happened. Like Dr. Kwan was saying, some people are joking about, oh yeah, sure, we're getting a PET CT. We'll see if it comes in before I retire. Some people actually did, but a bunch didn't. So when it actually came here and it was in pieces, when it was delivered in pieces, people in our team actually went to go see it being wheeled off the truck
Yeah.
in pieces, wheeled into a room, like everything you see here looks nice and put together, but in all those individual
long does
pieces,
this take?
How long did it take to install?
To assemble it, yeah. I'm not talking like the room construction.
Oh,
I mean,
wow.
like,
I think the actual installation took at least almost a month, right? So they have
Really?
to physically install it and then they have to test it.
Yeah.
So I think that was
which is,
a lot.
we like tests. Tests are good.
Yeah, and people were, peeking their head in the room, like, oh, watching the progress, seeing how it gets assembled. It was very, very neat for our team.
Yeah.
Even other teams too, like the other modalities, people from CT, X-ray, MRI, they all, eventually wander up here and be like, oh, so this is the new kid in town.
Oh, what you got over
They
here?
touched it a little bit, and then they lie on the bed and like, oh, this is kind of comfortable. That's not bad. So I think it's really brought a lot of our diagnostic imaging team together. It's been very motivating for our team because something actually happened. We did bring something new, something that's completely new and the cutting edge to our system. When we talk to a lot of our students now, right, they know that we have PET CT. They're more excited to come to Lakeridge for their clinical placements, or even when they graduate. I want to work at Lakeridge because we're now at the cutting edge. So it's exciting all around.
Well, I mean, you're a testament to that as well, right? No, truly, like wanting to come here because you're like, this hospital's, it's a community hospital. It's got a great cancer center. It's a great community. I want to be part of that. I want to be a change maker, right? I want to be a difference maker for people. Makes you feel like the hospital and the people who work there are actually seeing you, right?
Yeah,
Definitely. It does help in recruitment of personnel because, people are trained with the best technology and they want to use it after when they completed their training. So now we have it available, and it definitely helps in recruitment.
Yeah.
Technology staff, physician staff, just everybody in the hospital in general.
Not that you ever like take pride maybe in turning down applicants, but to be able to say like, we have our pick of the crop. And like, if we have 10 times as many people applying now, the cream rises to the top. You're going to have better people applying. And that means that patients are going to have better care and better outcomes, right?
Definitely.
Now, this falls under the broader diagnostic imaging umbrella. And you two are here, and we're very happy to talk to the two of you. You want to shout out some people? You want to shout out some of the other people that made it happen? Some of the other change makers?
Oh, for sure. I think first.
I thought you were going to say no. No. Credit is ours and ours alone.
Definitely goes to our charge tech. So our charge technologist, Brian Mugaji. So we had brought him on also in 2022. So
Big year.
Yeah, he was working at UHN as well. So he worked at Toronto General, Toronto Western, and Princess Margaret. So we brought him on for a lot of his PET CT expertise. So he's been instrumental in figuring out the logistics of how to schedule things, like what we do, teaching the staff. He worked a lot on the hot lab, and we're still working a lot on the hot lab. So we have our own what we call a hot lab, where we deal with all of our radiopharmaceuticals. So he's been very instrumental in that. So we've made use of a lot of his brain power and the knowledge that we plucked him from somewhere else that had trained him up. So that's a big shout out there. And I think a big shout out
and a pat on the back for you, right?
Well, getting him here, I guess.
Yeah, 100%.
And I think a big shout out does go to Dr. Kwan, because he's been here for so long championing this whole project, and he's still here. He hasn't left us yet. So he's still here reading nuclear medicine and PET CT at the same time. So dealing with all of our increased volumes, bringing on extra physicians to help out. So we couldn't have done it without Dr. Kwan, and he still guides us on what we should or should not be doing. So a huge shout out to our own DI team. But other than that, I think we've had a lot of support also from other programs and other departments in the hospital. So our HSC is Kirsten Burgomaster. So
Nobody knows what an HSC is. You do. What's an HSC?
So you just call her our VP.
Okay.
Our VP. So she sits on the regional team for cancer care as well in the Central East. So a big proponent of getting PET CT here. Our director, Ron Burke, has been here for quite a while as well. Also working with Dr. Kwan from the beginning of the idea of bringing in PET CT. So I think all these people that have been there from day one and are still here helped push this forward. And I think a big pat on the back goes to them for actually bringing it here. I just came on the last stretch, so I can't take all the glory. I just came on, oh, you got it? Okay, let's work on it. But they were pushing for it from the beginning, so...
That's going to make you feel pretty cool, right? I mean, listen, we always take compliments whenever we get them, right, Dr. Kwan? But
Wilson has done a lot of work. It's really a big team effort. Everything from administration down to, the nitty goodies. So it's really a big team effort, and everybody deserves a pat on the back. and foundation and so on. So we can't do it without other people's support. We are just on the underground front line doing our work.
I think we've seen news reports, and you're like, it's in an environment I'm sure the two of you are very familiar with. It's like, a room where you're reading the reports and there's a scanning technician room or whatever. And they're like, AI makes this so much easier and we're able to use AI to detect things better. Is that an overly simplistic way of looking at things?
I think AI is a tool, and it depends how we use that tool. Interestingly enough, Lakeridge has partnered with Ontario Tech for looking at AI specifically. So we have this partnership with them where we say give them some sort of maybe operational, logistical, or whatever problem, and they can see whether or not they can come up with some sort of solution using AI. So we're very mindful to make sure that any sort of use of AI is ethical and follows guidelines where, we're making use of AI in an appropriate manner.
Yeah, you're not like selling your data to Cambridge Analytica or anything like that.
Well, specifically for PET-CT, actually, the price of this scanner was astronomical, but included in that price, we do have some AI packages with this
Are you allowed to
PET-CT.
tell us like how much? You could say any number and I would believe you. Like, what is just the machine cost?
Just the machine?
Yeah.
About $2.74 million just for the
so
machine.
like a starter house. Okay. Yeah.
Sure. But within this $2.74 million, we did get some AI packages. So we have AI packages to help with motion, patient motion. So, when you're in that scanner, the tech is always telling you, don't move, don't move, don't move. And yes,
Sometimes
it's
you
kind
need
of hard.
to sneeze or
Yeah.
cough.
Your nose is itching. You need to scratch. You need to get that scratch. So patient motion is a big thing. So we have AI packages to help us kind of smooth over patient motion, right? So when we get you to hold your breath, some people can't hold their breath. Or when we're scanning your chest, your heart is beating. We can't stop your heart. So that all of that stuff is
Please
moving.
don't. Give me one thing. Let my heart keep beating.
Well, there you go. So your heart keeps beating. We can't stop your heart. We can't stop your bowels from moving either. So all that motion needs to be corrected in our images. Otherwise, it gets very blurry. So these things really help Dr. Kwan and some of our other physicians make their diagnoses by making those images better.
Mm-hmm.
Yeah. So those are some of the applications of AI that we currently have right now. But the sky's the limit, right? So there's a lot of things that we could look at AI for in terms of helping you diagnose, because there are certain algorithms that may be able to pick things up much, much quicker, as opposed to, Dr. Kwan scrolling back and forth through hundreds of images trying to pick something out.
Yeah.
Maybe a program could do that for him. So.
Well, and I mean, that's a big change in technology. Like in 1989, I think you could still smoke in a movie theater. So like, what was the kind of like technology you were using when you first started here at Lakeridge versus we're sitting next to a PET-CT scanner and we're talking about like the AI packages, like the extra downloads that came with the machine?
Well, back in the 80s, we were still using film. So we have X-ray boxes. So we put up the film and look at them. We have to actually develop the film. We have a dark room.
That's awesome.
With film, so we actually develop it. Oh, obviously, over time, that has gone away. We actually were in the first few hospitals that's gone away from film completely.
It's funny you say that. I started shooting film on a camera this year, and so I've started developing it and stuff as well. I'm not saying that I'm like a doctor. I mean, maybe a little bit. Maybe we have a little bit in common. So I think it's seeing a resurgence, kind of like vinyl records outside of hospitals. But yeah, I would imagine you probably made a switch to digital at this point.
Exactly. In the early 90s, we switched to digital. And obviously, digital has come a long way with improvement in technology. So as Wilson, you alluded with AI, I think it makes our life more efficient. It helps us to detect things better. It makes the images, improve the images, the sharpness of the image. You come from art background, you know how important the sharp images are for us to interpret it. So there's a lot of computer software that with normal database that we could sort of analyze to improve our analysis of the information that we get, because there's a lot of information. So everything, a little bit of help that we could get, the better. So I think AI will evolve over time. I have no idea how it's gonna go.
Yeah.
But it definitely does help us in our everyday work life.
Well, I mean, people hear the letters AI, and I think that often it is an oversimplification of what it is. Like AI, it's a computer program, basically,
Exactly.
right? It's able to predict things, not because it's sentient, but because it's a piece of computer software and it's been programmed to look for specific things and make connections. Right. Is it basically getting rid of the drudgery?
No, I don't think we should be scared of it. I think it does help us improve our ability to do things. I think that's how what it should be doing. So it's not going to take over people's job or life. It may in some extent, but it does overall improve our ability to do things. And we should, keep doing it.
The excitement is palpable. Like, it's just so cool. Like, the two of you have been smiling nonstop about this thing. And I can't imagine, like, I remember hosting the gala a couple of years ago, and the announcement was made. They had raised the $20 or $21 million. And this is part of a suite of things that were purchased and were going to be purchased. But, like, what does it mean personally for the two of you? We've talked about, like, patients and we've talked about community, but what does this mean to you?
Personally, it means a lot of extra work. But I think it's been eye-opening seeing how many different facets of bringing something new that you have to consider. When you bring something completely new, you have to consider construction, you have to consider purchase of the machine. But like Dr. Kwan said, you also have to consider training. You have to, I guess, collaborate with many, many different levels of government and many, many other stakeholders on bringing something like this on. So it's been an eye-opening experience for me and a great learning experience. And, it's, you mentioned feather in my cap. So it is a feather in my cap. How many managers can say that they've brought in a PET CT to a hospital?
This guy right here.
There's only 18 of them in the whole province anyways.
Yeah, look in the camera and say that.
So yeah, I think it's something very, very exciting. And I'm glad that it's been more or less a success, I think, on my end anyways, until my boss tells me otherwise. So personally, it's been a great achievement, personal achievement, but a great achievement being part of this team that brought it here.
What about you, Dr. Kwan? You've been working on this a long time, man.
Yeah, so I think from my perspective, the important aspect is now I'm able to actually offer more information. I feel that I'm helping the patient more because I'm now able to tell the oncologist, the surgeon, what's going on with this particular patient. We do have some limitation what we could do. So, for example, we see a lesion in the CT. Sometimes you don't know, is that something that we should be worried about or not? And now we have a tool that will help us. Nothing's perfect, but a little bit helps. And also we're able to offer how extensive the problem is. So to me, it's more able to offer more information for the patient and in helping him or her in his medical journey. And that's the biggest thrill for me, actually.
So humble.
Yeah, because that's why that's my job.
Yeah,
that's why I'm here.
But still, it feels pretty kick-ass to be able to I said I would do it and I did it. That's where the movie finishes, right? You're like, did it. Well, congratulations to the both of you. And congratulations to the community. And from a personal place, I got emotional the first time I saw this. I got emotional. I saw somebody being scanned as I walked by when I was taking a look at the control room a couple of weeks ago. It was an emotional moment for me. And good Lord, I hope I never need one of these things again. But if I do, it's here. And it's thanks to the both of you. So thank you very much.
Okay, thank you.
Thanks to Dr. Michael Kwan and Wilson Yiu for joining us on Brace for Impact presented by Lakeridge Health Foundation. Brace for Impact wants to give you a sneak peek behind-the-scenes look at how donor support makes all of this amazing work possible. We want to inspire you. We want to motivate you to make a difference in your own way. Because it's people like you who are making a difference in this community. My name is Kolter Bouchard. Join me by giving or getting involved at braceforimpactpod.ca.